Should people with erectile dysfunction caused by performance anxiety see a doctor? Hi, my name is Martha. I'm a clinical sexologist with a doctorate in human sexuality. I'm also a relationship coach, and you can find me at eroscoaching.com. So in this question, it says, for me, it has become a self-fulfilling prophecy. I believe it's mostly in my head. It really bothers me. I started to work out and stop watching pornography. But if you spoke to a doctor, which would one be able to give some help while working on getting their natural erections back? So this person is describing psychological ED. This is when they're not having a physical reason why they are not having an erection. It's not physical. It's not that they have some health issue. Some common issues that cause erectile difficulties include hypertension, diabetes, high blood pressure. This is psychological, meaning they're having performance anxiety, and then this becomes a self-fulfilling prophecy, meaning that they're anxious and then they have problems with their erection, and then because they have problems with their erection, this difficulty with the erection continues. So it becomes like a vicious cycle that seems to perpetuate itself and becomes worse and worse, because what happens is the person starts to lose confidence, starts to lose sexual desire. And so when I ask questions to clients about loss of sexual desire, sometimes the loss of sexual desire is not the cause. Sometimes the loss of sexual desire is the symptom. It's a symptom of something else. In this case, it is the psychological erectile difficulty. So you mentioning psychological erectile difficulty, and a medical doctor would prescribe Viagra, Cialis, Levitra. So these are medications that can help erection. And for some men, it can help to boost their confidence, because what they're having is not a physical problem. What they're having is a psychological anxiety. So having a stronger erection can help them with their confidence. For some men, it does not help. It does not help because their anxiety is so big that the drug actually doesn't really help that much, because they're so anxious. So it is really useful to work with a sexologist like myself to overcome the anxieties that they might have. And you'll be wondering, besides some marketing sales pitch that I'm doing, like what exactly would I be doing? So when someone has a performance anxiety due to their erection, this has to do with probably an episode that had happened because of their erection not working. It caused them to start getting action. So I would start going into tracing back to what actually happened to that first episode, to address it, to reassure my client. For instance, oh yeah, it started to happen because on that particular day you were like kind of drunk, or on that day you were really stressed about work, or yeah, you're probably grieving about your somebody's death in your life, and so on and so forth. So we talk about what might have caused this to happen, so that my client will start to have some understanding around it. So obviously I can't do that with you because I don't know you, but I can kind of tell you like what are some of the things that a sexologist might do. So we go into understanding the background behind it. Then we'll understand like what have you tried, and one of the solutions from then on is helping my client to really start connecting with their body and becoming more confident with their erection. So having certain practices around getting them to do them, so that he will start to realize, oh yeah, you know what, actually my penis does respond to me, my penis does work with me, and I need to listen to my body and honor my body and not be so rough on myself and like saying like negative things to myself. And then when you start having confidence by yourself, when you're with a partner, then it's much easier. Some of the other things that I do sometimes with a client is do a little bit of role playing, where I get them to practice with me how they would communicate their anxieties with their partner, so that they have a better situation, and then the partner has more of a realistic expectation that like, you know what, let's just focus on play, things like that. So there are many things that I do when I work with a client depending on the exact situation, and these are just some of the things that a sexologist myself might do. So it's important to work with someone who actually is trained and certified, who is sex positive, who is comfortable talking about these issues. I'm comfortable talking about it because of my training, because of my experience, but not everybody is. So it's important to look at the credentials of your sexpert. One of the things that happened to actually somebody I know is that they went to somebody who calls themselves a sex therapist, but then was actually belittling him. Was actually saying, you know what, there's so many ways to have sex. Like, forget about your penis. Like, that's not. Yes, there are many things that he can do. He knows that, and he's willing to do that. But on top of that, what could he do with this exact issue? And that exact issue that he went to this sex therapist was not addressed. And so there was a lot of shaming that actually was put onto him because the sexologist also happens to be a woman. So it's really sad to hear this, because he asked a very specific question, and yes, there are other things around it. Sure, you can address that, but please, like, work with him on what he wanted to learn, and basically, not addressing that issue at all. So this is Martha of Eros Coaching. I'd love to hear from you, thoughts, comments, and if you have more questions, drop me an email at ask@eroscoaching.com.